Within the largest city of Taiwan, Taipei Medical University is located in the Xingyi district and only a mile away from Taipei 101. The College of Medicine is the biggest college of TMU. It values students' integration of humanistic spirit and medical fields. All departments incorporate basic medical science, clinical medicine, and medical application education, research, and related support. We emphasize the cooperation between basic and clinical research groups and the innovation and development of biotechnology.
Hello, my name is Stephen. I study medicine in TMU. In TMU, we have an extensively diverse curriculum, which emphasizes studies, problem-based learning, and of course, clinical skill development. Our affiliated hospital has developed from a compact facility into a prestigious healthcare system with over 3,000 beds.
Furthermore, our simulation system provides education from basic clinical skills to patient safety. We educate students using a simulation approach, while offering various study channels to increase medical-related skills.
After my 6 years of professional training, I wish to become a doctor with the strength and generosity to serve my society well.
Hello, my name is Kevin, and I'm a student of the School of Respiratory Therapy in Taipei Medical University. TMU was the first in Taiwan to set up the bachelor degree for respiratory therapy. It also provides a master's program, which is the thoracic medicine. The success of our program is reflected on the high pass rate for the respiratory therapist licensing examination, which is over 90%, and not many out there to say that like us.
TMU's School of Respiratory Therapy has professional educators in the primary, clinical, and respiratory therapy fields. Their goal is to train professionals in respiratory therapy and thoracic medicine researchers. Our purpose is to strengthen students' clinical and critical care skills, providing national and international internships, along with enhancement of employability skills.
Hopefully, in the future, I'll be able to utilize all my professional knowledge as a respiratory therapist and help those unfortunate patients in need to overcome the challenges of their lifetime.
I'm a student of the Graduate Institute of Clinical Medicine of Taipei Medical University. Our institution was established to help clinicians gain further research experience and expertise.
Welcome to all participants who are already in the Zoom meeting room. We'll start this webinar any minute now. Please be seated and make sure that your microphone is mute.
Selamat datang diucapkan kepada seluruh partisipan yang sudah berada di ruangan Zoom. Kita akan segera memasuki acara webinar ini. Dimohon untuk memastikan bahwa mikrofon Anda dalam kondisi on.
To the Honorable, the President of Himpunan University, Professor Dr. Insinyur Eko Handayanto, M.Kes. To the Honorable, the Dean of Faculty of Health Science, Dr. Insinyur K.S. Ahmadi, Esti. To the Honorable Professor Shannon, Chiu, RN, Ph.D. and Dr. Heni Setyowati, Esti, Rahayu, S.Kp, M.Kes as the speakers. To the Honorable, the members of Faculty of Health Sciences and all respected participants of today's international webinar.
Yang terhormat, Rektor Universitas Tribhuwana Tunggadewi Malang, Profesor Dr. Insinyur Eko Handayanto, MSc. Yang kami hormati, Dekan Fakultas Ilmu Kesehatan, Bapak Dr. Insinyur K.S. Ahmadi, MP. Yang kami hormati Profesor Shannon Chiu, RN, Ph.D, dan Ibu Dr. Heni Setyowati, S.Di Rahayu, S.Kp, M.Kes selaku narasumber. Yang kami hormati Ibu dosen Fakultas Ilmu Kesehatan, seluruh tamu undangan, dan hadirin para peserta webinar yang kami banggakan. Assalamualaikum warahmatullahi wabarakatuh.
Good morning to all of us.
Selamat pagi dan salam sejahtera untuk kita semua.
Alhamdulillah, let us pray thankful to the presence of Allah Subhanahu wa Ta'ala, who has given the grace and hidayah to all of us, so allow to attend this webinar in healthy condition.
Dengan mengucapkan syukur Alhamdulillah, mari kita panjatkan puji syukur kehadirat Allah Subhanahu wa Ta'ala yang telah melimpahkan rahmat dan hidayatnya kepada kita, sehingga kita diperkenankan hadir di tempat ini dalam keadaan sehat walafiat.
Next, allow us as the committee to say welcome to International Webinar of Complementary Therapy in Nursing, Enhanced Nursing Care Outcomes. And we thank you for all nurses, practitioners, and nursing students for your presence on today, Saturday, August 6, 2022, online webinar.
Selanjutnya, izinkanlah kami selaku panitia mengucapkan salam selamat datang di acara International Seminar Complementary Therapy in Nursing to Enhance Nursing Care Outcome. Dan kami ucapkan terima kasih atas kehadiran Ibu, Bapak, perawat, praktisi, dan rekan mahasiswa dalam acara ini yang diselenggarakan secara online pada hari ini, Sabtu, 6 Agustus 2022.
Next, we're going to next session, singing the national anthem of Indonesia Raya, Taiwan's national anthem, Tribuana, and Indonesian National Music Association hymn.
Baik, Bapak dan Ibu hadirin, berikutnya menyanyikan lagu Indonesia Raya, lagu kebangsaan Taiwan, himne Tribuana, dan Mars PPNI.
Bangsa dan nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk menghantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu, serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Well, before we begin the event, I will read today's agenda. The first agenda is opening and praying. Second is opening speeches. Next is the presentation by both speakers and continue to a discussion section. Fourth is panel discussion. Fifth is certificate ceremonial. Is door prize, and the last agenda is closing.
Baik, sebelum memulai acara, saya akan membacakan susunan acara pada pagi hari ini. Acara yang pertama, pembukaan dan doa. Acara kedua, sambutan-sambutan. Acara ketiga, yaitu acara inti, penyampaian materi seminar, dan juga diskusi mengenai materi yang akan disampaikan oleh kedua narasumber. Acara keempat, diskusi panel. Acara kelima, penyerahan sertifikat pemateri kepada narasumber. Acara keenam, pembagian door prize. Dan acara yang terakhir, penutup.
Ladies and gentlemen, let's open this event by a prayer led by our Hsiao-Yean.
Baik, agar acara berlangsung dengan lancar dan juga bermanfaat bagi seluruh peserta yang hadir, marilah bersama-sama kita membuka acara pada pagi hari ini dengan pembacaan doa yang akan dipimpin oleh Saudara Hsiao-Yean. Kepadanya kami persilahkan.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us bow our heads for a moment. Pray to God Allah Subhanahu wa Ta'ala so that our international seminar can be precious to all of us. I will let's pray based on the teachings of Islam and those who are not Muslim. You are free to pay according to its your belief. Paying begin. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan syakirin hamdan yu'affi ni'amahu majidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhika wa li azimi sultanik. Allahumma shalli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Allahumma inna nas'aluka as-salamata fid din wad dunya wal akhirah wa afiyatan fil jasad wa sihhatan fil ilmi wa ziyadatan fil ilmi wa barakatan fil rizqi wa taubatan qabla al-maut wa rahmatan inda al-maut wa maghfiratan ba'da al-maut. Allahumma awin alaina fi sakaratil maut wa najatan minan nar wa afwa inda al-hisab. Allahumma inna na'udzubika min 'ilmin la yanfa' wa min qalbin la yakhsha wa min nafsin la yas'a wa min du'atin la yusbihu laha. Rabbana taqabbal minna innaka antas samiul 'alim wa tub 'alaina innaka antat tawwabur rahim. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wa sallallahu ala nabiyyina wal mursalin wa ala alihi rabbal alamin. Al-Fatihah. Yes.
Thank you. Next, speech from the Chief of the International Webinar Committee. Please welcome Hsao-Yean Rosalia Riada.
Diucapkan terima kasih kepada Saudara Syifa Ulinas. Selanjutnya, sambutan dari Ketua Pelaksana kepada Saudara Hsao-Yean Rosalia Riada selaku Ketua Panitia Seminar Internasional. Saya persilakan.
Thank you for the opportunity given to me. The Honorable Professor Dr. Insinyur Eko Handayanto, M.Sc, as the President of the University of Tribuana Tunggadewi, the Honorable Dr. Insinyur K.G.S. Ahmadi, S.Kp, as the Dean of the Faculty of Health Science, the University of Tribuana Tunggadewi, the Honorable Professor Chiu, RN, Ph.D, and Dr. Heni, Setyowati, Esti, Rahayu, S.Kp, M.Kes, as our keynote speaker today. The Honorable Guest Hall, Faculty Member of Faculty of Health Science UNITRI, all guests and participants who I really proud of speech be upon you all mercy and blessing to us. My name is Hsao-Yean Rosalia Riada, as the chairman of this agenda. Here I will be reporting the number of registered participants in this seminar, which we finally host on today, August 6, 2022. The total number of registered participants upper 1,000 participants within the number of nursing students commit are 20%. This activity is also a series for the 21st anniversary of Tribuana Tunggadewi University celebration. The material that will be present by our wonderful speaker is part of a novelty in the field of complementary nursing therapy, which is very supportive of the development of nursing science. We hope everyone may listen carefully, join until the end of each session, and together we may take the benefit from the presentation. Last but not the least, I hope you enjoy this webinar. Thank you so much.
Thank you, Hsao-Yean Rosalia Riada, for the speech.
Terima kasih kami sampaikan kepada Ketua Pelaksana.
Next, opening speech from the Dean of Faculty of Sciences will be delivered by Dr. Insinyur K.G.S. Ahmadi, S.P. M.P. Ladies and gentlemen, please welcome Dr. Insinyur K.G.S. Ahmadi, S.P. M.P.
Baik, Ibu Bapak yang kami hormati. Selanjutnya yakni sambutan sekaligus pembukaan secara resmi dari Dekan Fakultas Ilmu Kesehatan. Dalam hal ini akan disampaikan oleh Dr. Insinyur KGS Ahmadi MP. Kepada Dr. Insinyur KGS Ahmadi MP, saya persilahkan.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to everyone. Welcome to the webinar. Today, Faculty of Health Science, Tribhuwana Tunggadewi University had an international webinar with the topic complementary therapy to improve nursing care outcome. The purpose of this webinar is to increase and enrich knowledge in the field of complementary of lecturers and students of the Faculty of Science, Tribhuwana Tunggadewi University, as well as participants from other institutions. On this occasion, we would like to thank to the speakers, Professor Shannon Chiu, Ph.D. from School of Nursing, Taipei Medical University, and Dr. Heni Setyowati from Faculty of Health Science, University of Muhammadiyah, Magelang, who have been willing to share knowledge in today's seminar. We hope that the seminar can provide benefits for the development of knowledge of complementary therapy, especially at the Faculty of Health Science, Tribhuwana Tunggadewi University. And then by saying Bismillahirrahmanirrahim, the webinar on the day is declared open. Thank you. Join to the seminar. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mr. Ahmadi, for giving the speech and opening the event.
Terima kasih kepada Dr. Insinyur KGS Ahmadi MP yang telah memberikan sambutan dan juga sekaligus membuka acara kita pada pagi hari ini.
Before we are moving into the next
agenda, all participants are pleased to fill out the attendance form that has been shared in that room or YouTube chat link.
Sebelum kita memasuki kepada acara selanjutnya, Bapak Ibu hadirin sekalian, dipersilakan untuk mengisi form presensi kehadiran pembukaan yang telah di-share di Zoom chat maupun link chat YouTube.
Ladies and gentlemen, the core event of today's webinar entitled Complementary Therapy in Nursing to Enhance Nursing Care Outcomes is start. We are going to hear presentation by Professor Shannon, Chiu, R.D. and Dr. Heni Setyowati, Esti, Rahayu, S.Kp, M.Kes. And the presentation moderated by Hilda Masarina Devi, S.Kp Nurse MSc.
kita akan segera memasuki.
Bapak, Ibu hadirin, kita akan segera memasuki acara inti, yakni seminar dengan topik Complementary Therapy in Nursing to Enhance Nursing Care Outcome, yang akan menghadirkan Profesor Shannon Chiu, RN, Ph.D. dan Dr. Heni Setyowati, Esti, Rahayu, S.Kp, M.Kes sebagai narasumber, dan dipandu oleh Ibu Hilda Mazrina Dewi, S.Kp, NS, NSC sebagai moderator.
Please welcome Ms. Hilda Masarina Devi, S.Kp MSc.
Kepada Ibu Hilda Mazrina Dewi, S.Kp, NS, MC, dipersilahkan.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, and thank you to coming to our first international webinar. This webinar is initiated by our nursing student, so hopefully we may get the benefit together. First of all, I would like to say thanks to our experts today, Professor Shannon Chiu from Taipei Medical University as the first speakers of our agenda, and Dr. Heni Setyowati Esti Rahayu S.Kp M.Kes as our second speakers, which will be delivered with update issues on complementary nursing therapy to increase the nursing role and outcomes. Me, Hilda Mazarina Devi, I will be your moderator today, and please let me introduce our first wonderful and beautiful speakers here. Good morning, Professor Shannon.
Hello, good morning, everyone. I'm Shannon. Long time no see. Hello, Hilda.
Thank you for coming to our webinar. Her name is Professor Shannon Chiu. As you may read in our flyer and the announcements, she will give a talk about non-pharmacological intervention for managing insomnia as an emerging role in nursing. Actually, beside her role as teaching and become a lecturer in Taipei Medical University, Professor Shannon is also a practitioner. She holds a position as a nursing supervisor in Department of Nursing in Taipei Medical University Hospital. She wants a lot of grants and study or research experience, published book and produced many phenomenal works in critical care issues, neuroscience nursing, sleep disturbance, and neurofeedback in symptoms management and meta-analysis study. Actually, I really admire her in many aspects since our first meet in Taiwan in 2015. She mentoring a lot of Indonesian students there, and I believe some of the students also coming here today, some of the alumni also joined this webinar. And she is very accommodated and helpful to international students who are living in Taiwan. I suggest to the audience to pay very much attention on her presentations about many non-pharmacological interventions that nurses can lead. So you may get a wonderful knowledge and insight to enhance the nursing role and also promote nursing care development, especially complementary therapy in the future. So please, Professor Shannon, the 30 minutes is yours. Thank you.
Okay, thanks, Hilda, for your wonderful introduction. And now it's my time. So for the following 30 minutes, I'm going to share some of the updated knowledge about the insomnia symptoms management. Okay, so now please allow me to share my screen. And I just want to check that whether everyone can clearly hear my sound. Is that okay for all of you? Yes? Okay. Yes. Okay, let me share my screen. Okay, so can you see my screen? Yes? Okay, so today the topics I'm going to focus on the non-pharmacological intervention for managing insomnia because I think that I want to indicate an emerging role in nursing field. Okay, and this is my, so wait a minute, I trying to, let me see that. Okay, fine. Okay, so this is my, the slide to introduce myself, but, luckily Hilda already mentioned this part, so I'm going to skip this slide. So the first questions I would like to ask all the audience now, do you sleep well last night? Okay, so probably you can think about that and ask yourself. So I know that a lot of people probably will not, really recognize sleep is an important issue for you. But however, have you ever think about that? Why human needs sleep? Okay, and this is also the important part I'm going to deliver in the first part of my presentation. Okay, and as you can see this graph, And probably you, in your mind, you will say that, okay, professor, and this figures is trying to, deliver the concept about the human revolution. But why I put this figure for you? That's because, there's a very famous, sleep researcher. He has mentioned this sentence before, because he said that if sleep does not serve an absolutely vital function, then it is the biggest mistake the evolutionary process have ever made. So this sentence implied what? Implied that if sleep doesn't play an important and critical role in our human life, why is still occupied 1/3 of our lifespan? Yeah, so it means that probably sleep do something to us and keep, for example, like keep our health, and can prevent some, of disease, probably. Yeah, so probably for like 30 or even like 40 years ago, a lot of sleep scientists that they put their full focus on sleep because they're trying to solve some of unanswered questions about sleep. So before we move further to talk about, insomnia means you cannot sleep well, or it means that you probably sleep less than your expectations. Probably we have to think about that. What is sleep? So let me introduce briefly about sleep structure, okay? So as you can see that the whole night sleep structure actually can be divided into two parts. We can call it as rapid eye movement sleep, and briefly we call it as REM. And another cycle we call non-REM. Okay, so the whole, a cycle of a sleep usually be, consisted by these two phases. And for the non-REM sleep, it also can be divided into stage 1, 2, and 3. And as you can see that in the past, usually the sleep stage can be divided into 4, but after the 2007, the stage 3 and 4 be combined into just one. We call stage 3. Okay, but however, you can see that. So now the stage 1 here, it means it's going to occupy the 2 to 5% of your all sleep. Okay, the whole night sleep. And for stage 2, it's around like 50%. And stage 3, this one is the one I mentioned for non-REM sleep, just combined in the stage 3 and 4. And we also call it sleep, slow wave sleep, or delta sleep, or deep sleep. And it's going to occupy the whole night sleep around like 10 to 15 minutes. And for the REM, sometimes someone will call it stage 4, but you can just easily to call it REM. And REM is going to, take up around like 25%. So usually for a whole night sleep, I'm trying to move down. Okay, for a whole night sleep, so you are going to experience 4 to 5 sleep cycle. Okay, as I mentioned earlier, a sleep cycle usually consists of 2 parts, REM and non-REM. So for a whole night, you are going to experience 4 to 5 sleep cycle per night. Okay, so as you can see this hypnogram, and you can see that usually when you are awakened and you move to stage 1, stage 3, and stage 2 into stage 3 for a period of time, and then probably your sleep status will move to the REM, and this we call a sleep cycle. So this, as you can see, the x-axis shows the time, okay, from the midnight to the early morning, and you have like a 4 to 5 sleep cycle here. But now if I use a line, a vertical line to just cut our whole night sleep into 2 parts, like the first night and the later night, and you can see that actually a human usually experience longer percentage or higher percentage of stage 3. But in the latter nights, you can see that we usually experience more REM sleep. Okay, that's because in stage 3, the human usually need this time to recover your body. Okay, and because in stage 3, usually your body is going to secrete the growth hormone and to help you to grow up. So that's I'm not sure in your country, but in Taiwan or in our Chinese culture, usually the elder people always ask the like children, you have to sleep well and then you can grow up. And this, I think this is the reason. Okay. And for REM, this part also play an important role in your life, because during your sleep in REM, it can try to release your stress during the daytime, like you would dream in the REM sleep. Okay, and usually combine the stage 3 and REM can also help you to consolidate your memory function. So do remember, if you study harder in the daytime, you have to sleep more and better in the nighttime, because this is the only way. If you goes to the stage 3 and the REM sleep, it's going to help you to consolidate the memory you just put in your head during the daytime. And this figure just trying to show you about, usually, for our human life or our lifespan, usually your sleep is going to change, with your age change. For example, like obviously you can 3. So usually from the younger people to older people, you can see that the percentage goes down a lot. Okay, for REM, just a little bit. But the WASO means, WASO means the wake after sleep onset, means, in your old, if you are older people, usually you are going to, frequently wake up during the nighttime. And sleep latency, there's a lot, did not change a lot. So from this figure, you can understand for a, an older people, usually you will, sleep poor, and with the less deep sleep and more WASO. Okay. And now I'm going to move to the insomnia, since I just have 30 minutes. But what is the insomnia? Insomnia, the definition is about a difficulty with sleep initiation, duration, consolidation, or the quality that occurs despite adequate opportunities and situations for sleep. So currently there are 3 different diagnosis tools. Okay, we call it like a DSM-5, ICSD-3, and ICD-10. Okay, but no matter what, if you are a sleep expert or sleep specialist, you can use either one to diagnose your patients with insomnia. Okay, so as you can see that the prevalence of insomnia around the world is around like 30% to 48%, but depending on what tools you use to diagnose your patients. And usually we can easily to classify our patients into different types of insomnia. For example, probably if you are falling asleep more than 30 minutes, we will say that you are kind of, difficulty in sleep onset insomnia. But if you are a light sleeper, means that you might frequently wake up during the nighttime, and we call you are the difficulty in sleep maintenance insomnia. But also there's another type we call early morning awaken. Sometimes you probably wake up in very early morning and you never just falling asleep, and we call this kind of insomnia as early morning awaken. And when we talk about insomnia, we must mention about the 3P model. And 3P model here is the 3P. The first P is predisposing factor, means the nature and who you are. And usually we look at the person characteristics. For example, if you are a person with anxiety, or depression's characteristics, it's going to increase the risk of having insomnia. And the second P we call precipitating factor. Precipitating factor means that probably during your life experience, you might just face a stressor, and this stressor is going to trigger the onset of insomnia. For example, probably someone who you love just passed away, right? Or now you are going to face a huge, challenge like a big test examination, kind of this stressor. If combine the first P and second P, for example, like you are an anxiety persons and anxious persons, and you're going to have this stress to trigger the insomnia. Oh my God. This status we will call you as acute insomnia case, okay? But if we move to the third P, we call it perpetuating factor. Perpetuating factor means that this factor is going to maintain your acute insomnia to chronic insomnia. Wow, that's a big issue. Because usually if you are in acute insomnia status, and if we move out the stressor, right, you may, recover and back to your normal life. But if there's some factor is going to maintain your acute insomnia for a period of time, and then you will move to have a chronic insomnia. So the following interventions later we are going to mention will to think about that, how we can, prevent a person to become having, chronic insomnia. And this is also an, critical role for a nurse. And this one, we just talked about the sleep regulation. However, sleep regulation, you just need to remember there are two main concepts. The first one is about the sleep drive. The second concept is the biological clock. Biological clock, probably you might heard that before. It's also called as circadian rhythm. So the circadian rhythm, just like you have an internal clock in your body, and this internal clock is going to determine when you are going to sleep and when you should wake up. Okay, so usually probably you can try to force your internal clock to adjust and trying to adjust your life. However, you still have to follow your biological clock. Otherwise, you will feel very difficult to, for example, if now do you remember if you are a nurse, when you work in the night shift, you for the first few days, you will feel very difficult, right? Because your circadian rhythm just tell you that now is during nighttime and should be your sleep time. But however, you have to wake up and, work. And this is how the internal clock work. Okay, it's trying to force you to fall asleep. However, when we look at the sleep drive, and sleep drive is kind of a status, from the early morning, and usually your sleep drive is going to increase over time, over a day, but probably just till the 11 p.m. and your sleep drive is is to the top or to the peak of a day, and then this part is going to falling asleep. Because when you look at here, and this is the 11 p.m. Could you see that? And usually when your sleep drive to the 11 p.m. and will ask you to falling asleep, and this is the internal clock is going to take over the role, right? And make you falling asleep. And this is how the work, sleep drive and biological clock to help you to falling asleep. And how to assess sleep? Usually we will use like a sleep diary and sleep history. We are going to ask them, and of course we are going to use some screening tool and examinations. Of course, you have to consult the sleep specialist. I'm not sure in Indonesia, but in Western country or in like Taiwan, almost every hospital set up a sleep center. And inside the sleep center, usually we have like a sleep specialist, or we have like a psychologist and nurses, and trying to help patients to fall asleep. And usually for the objective, sleep tool, we will use the polysomnography and actigraph, this kind of, tools to assess our patient's sleep. And for polysomnography, actually is the whole night sleep record, and it's a gold standard to diagnose a patient with sleep. Okay, and usually we will ask the patient to sleep in a sleep center. And usually you can see that this is the real picture for sleep center, because we are going to, make up and set up the sleep center just like a hotel, and make patients, they sleep here, feel comfortable. And you see that here is the polysomnography device, and we will hook up on our patient's surf body and to measure their whole night sleep. And this is a control run. Usually the sleep specialist or technician will sit here and monitor patient's whole night sleep. And for subjective tools, usually we'll use different questionnaires to assess our patients. And as I know, now some of experts in Indonesia also translate these questionnaires into Indonesian version. So in the future, if you are interested in sleep, probably you can adapt these questionnaires in your study. For example, like Insomnia Survey Index, Epworth Sleepiness Scale, and Pittsburgh Sleep Quality Index. So now I'm going to talk about the non-pharmacological intervention. Okay, I'm not sure, because I put on this figure. I'm not sure in Indonesia, but in a Chinese culture, usually we will, in the past, we will, just ask our patients in the past. Okay, if you cannot sleep, just count the sheep. Okay, 1, 2, 3, 4, and just focus on this, and you are going to fall asleep. But in this updated knowledge, we know that actually the counting sheep is not going to help you to fall asleep. Okay, because it's going to make your mind to focus on something, and your brain wave is going to, go fast. So you cannot fall asleep. Okay, so now I usually will use this photo and tell our people, please don't do so, because this strategy is not useful at all. So current treatment option for insomnia, including 2 parts. The first one, of course, everyone knows that is pharmacological treatment, including we will use like a benzodiazepine, non-benzodiazepine, or orexin receptor agonist, and melatonin agonists, or like antidepressant drugs. Okay. However, some of BZD or non-BZD drug is going to cause more, a severe problem. For example, if the older people, they take the BZD or non-BZD drug, certain of them, is going to increase the risk of fall. Okay, so I think now, even based on the American sleep associations or the European Sleep Association guideline, they do not suggest the use the pharmacological interventions as the first line intervention. However, let's put our focus on non-pharmacological intervention, and here is also the things we can do. Okay, and based on American Sleep Association and European guideline, all of them suggest please do the cognitive behavioral therapy for insomnia as the first line treatment for patients with insomnia. But unfortunately, the CBTI actually cannot be implemented by nurses. Only the certified psychiatrists and psychologists can do so. Okay. However, luckily, and in a few years ago, a professor from in USA, and we call his name is Daniel Bicey, and Dr. Bicey, he developed a new treatment. Actually, we can say it's a brief behavioral treatment for insomnia. And the differences between the first one and second one, we just take off the concept of the treatment component of cognitive component. And later I will explain more and to see how nurses can do so. And others intervention include like exercise, light therapy. However, from previous evidence, we still need more evidence to support, okay, the exercise and light therapy for managing their insomnia, okay? And today my focus on brief behavioral therapy, because I think this will be the whole new word for you. Probably you never heard this term before. But here, this is just a meta-analysis to talk about the CBTI. And from the paper, if you are interested, you can just download and read them. And inside it introduced there are 5 components for CBTI, include stimulus control, sleep restriction, sleep hygiene, cognitive therapy, and relaxation approach. And this is also from, as I mentioned, and Journal of Clinical Sleep Medicine from the American Sleep Association. And this one also mentioned that behavioral and psychological treatment for chronic insomnia. And here you see that they strongly recommend clinicians use multi-component CBTI for managing the chronic, insomnia. And of course, you can also use the multi-component brief therapy, which is the BBTI for insomnia. And of course, here they also mention the different, for example, like a stimulus control can be a single component therapy. Okay, but this is all the conditional recommendation. Okay, because they still need more evidence to suggest that. So now we just focus on the BBTI, and the first component is about the stimulus control. And the concept about stimulus control is trying to reconnect the association between the bed and sleep. So we will use like different rules and to help our patients. For example, there are 4 rules. And the first one is the reduced time in bed. However, do remember when you're trying to reduce the patient's time in bed, please never reduce time in bed less than 6 hours. This is the principle, okay? And the second rule is about get up at the same time every day and go to bed when sleepy and get out of bed when not sleepy in 30 minutes. For the third and fourth principle is kind of easy to understand. So only you feel sleepy and go to your bed. But if you lie on your bed and you feel like you cannot fall asleep within 30 minutes, please get up. Okay, get up. Please don't lie on your bed because that situation is going to increase your stress and you never fall asleep. Probably you have this kind of feeling. And just get up and go to another room. And later I will teach you how to do like a relaxation strategy. And during that run, you can do this relaxation strategy and help you to feel sleepy and go to bed. And there's this one, get up at the same time every day. This one just mentioned and that you know, because when if you cannot sleep very well last night, and usually if next day you do have other, schedule, you will try to sleep late, right? But this is not the good thing you should do. Okay, because we have to create a normal sleep pattern. So we will require our patients get up at the same time, even though you did not get sufficient sleep last night. And because this is going to increase the sleep drive. Do you remember early? I just mentioned the sleep drive. And it's going to increase the sleep drive into the nighttime and you are falling asleep quickly. Okay, so please do remember, get up at the same time. And trying to reduce the time in bed, just like a principle, and put all 3 together. Okay, because when you reduce the time in bed, it's going to help you to put more time to falling asleep. And for sleep restrictions is a very difficult part. And on this, you have received the training about the BBTI. Otherwise, I won't suggest you to use this to instruct your patients for their sleep. Okay, but however, the principle for sleep restrictions is trying to instruct to sleep for average total sleep times, estimate for the 2 weeks sleep diary. And usually we will look at like sleep onset latency and WASO, wake after sleep onset, to monitor and adjust their sleep time. For example, if the sleep onset latency and WASO less than 30 minutes, and most of night, we will add 15 minutes okay, to time in bed. Means you can lie on bed more than 15 minutes every day. Okay, it can be advanced bedtime or delay the wake up time. But if their sleep onset latency or was greater than 30 minutes, which means not good, right? Because it means you cannot easily to fall asleep or you are frequently awake during the nighttime. And we are going to reduce the time in bed by 15 minutes every day. So usually a therapist, since you are a nurse, and you will adjust and look at the sleep diary and adjust and discuss about the sleep restriction strategy with your patients. Okay, it's not easy. It's not easy. And this is also the things I'm doing in Taiwan. So because recently I just got the government grant trying to adopt the Taiwanese BBTI in Taiwan. And fortunately in Indonesia, now one of my PhD students and Faisal Hassan, and he will implement the BBTI, Indonesian version BBTI in your country in the nearest future, okay? And about the sleep hygiene, and there are a lot of, principle you might know, like you must have like a regular exercise and good bedroom environment and regular meals. And this is all the tips I just write down here, but because of time limitations, I'm not go through it one by one. But just let you know, for example, like please before the bedtime, you must limit the fruit intake and avoid some of the caffeine drinks. But please do remember, if during the nighttime, like early morning, probably you will ask me like, Professor, can I just drink a coffee when I get up? Of course, definitely you can do so, okay? But please just limit the caffeine, please don't drink it 4 hours before your bedtime. But in the early morning and before the noon, I think should be okay. And please also avoid alcohol. But I know in your religions, alcohol is not allowed, so I think should be okay. And of course, avoid smoking in the evening because I think nicotine is acts as an stimulate, and it's going to interfere your sleep. So please don't smoking in the evening, okay? And the last one is about the relaxations. Here I talk about the autogenic training. And autogenic training is a very old strategy and just help you to focus on your body. So when I talk about that during the nighttime, if you cannot fall asleep within 30 minutes, please, just get up and leave your run into another quiet and silence and with dim light room and sit there and just focus on your body. Like you can image that you have like heaviness of your arm and legs, and you can feel that now it's warm throughout your arms and legs, and trying to feel the sensation of warmth and heaviness in your heart, and focus on your breathing. And usually the breathing, I usually will ask my patients to do like a like a slow and deep breathing, okay? Because this kind of breathing is going to stimulate the parasympathetic tone. It's going to slow down and your heartbeat, and also trying to put your body into a very comfort and very slowed pattern, okay? And of course, then move your sensations of warmth into your abdomen. And then if you want to go through the whole body, of course, it's go to up, and you can feel the sensation of coolness in the forehead. And usually I will teach my patients to do this like autogenic training. And I also design a mobile app. So usually my patient, they can easily to use like this kind of trainings when using their app, okay, and help them to fall asleep. And usually when I teach my patient using the autogenic, training, I will use a very, nature, things, picture in front of them, and feel then they can image that they are in very, comfort, environment for them, okay. And I think now this is the, for the CBTI around the world, a lot of people, they develop like a sleep pill or like a CBTI coach, or like a others apps to help patients to fall asleep by using this, because this is a very famous non-pharmacological intervention for managing insomnia. However, as I mentioned that nurses cannot do so. However, the BBTI is a good strategy, and also is suitable for nurses to do so. So that's why in Taiwan, I'm trying to, build up the app, and now almost done. I hope that I have the time to share this with you, but it's all in Chinese. But hopefully in the future, you can develop your own app by using this BBTI, okay? And I think this is all my presentations. Now I just want to make sure that I can receive any QA from audience, or have to, receive the QA or answer that in the end of whole, seminar webinar. Yeah. Okay. Now I'm ending, and time's yours. Hilda.
Yeah. Thank you, Professor. Such an amazing presentations for the audience. If you have a question to Professor Shannon, please keep it up until we finish the second session with Dr. Heni. So please wait for the questions, Professor. And now we are going to the second session. Let me introduce our second speakers, Dr. Heni. Good morning.
Good morning, Ibu Hilda.
Yeah. So she is Dr. Heni Setyowati, Esti Rahayu, S.Kp. M.Kes. She also has a lot of amazing recognitions as a nurse and lecturer. Right now, she holds a position as the Dean of Faculty of Health Science in Universitas Muhammadiyah Magelang. And beside her busy jobs in lecture and managerial, she wants a lot of grants, writes some books, has many intellectual properties and patents experience, especially on the maternal health nursing and complementary nursing topic. She will deliver her latest findings on chromopressure to reduce the fatigue among women workers in Indonesia. I believe every of us ever feeling fatigue and loss of the energy in the end of the day, every day, I believe. After so much activity as the students, as the nurses or workers, especially for women. So what kind of chromopressure therapy is, and how to deliver the therapy, and can we practice it to reduce our fatigue daily levels? So let's pay attention on her talks. And so Miss Heni, the 30 time is yours.
Okay, thank you Ibu Hilda. Assalamualaikum warahmatullahi wabarakatuh. Can my voice be heard? Okay.
Yes.
Our Honorable Rector Universitas Tribuana Tunggal Dewi, our Honorable the Dean and Member Faculty of Health Science Universitas Tribuana Tunggal Dewi, Professor Hsiao-Yean Chiu as speaker, Sawadika, Prof. Our Honorable the Committee Chairman, the Head of Nursing Student Association, and all participants. Thank you for the opportunity given to me to share our knowledge today. I'm sorry if my English is not good. I will present about, I'm sorry, I will share screen. Yeah, I will present about chromopressure to reduce work fatigue. Okay.
Mrs. Heni, yes. I'm sorry, yes. Your camera, can you turn down? So we can.
Yeah, okay, thank you. It's enough. Okay.
Thank you.
Yes. Okay. Chromopressure is a combination of two therapies, namely chromotherapy and acupressure. Okay. About chromotherapy is an alternative holistic health treatment used to improve health and alter your mood. Each particular color contains healing energies. Chromotherapy is a method of treatment that uses wavelengths in the visible regions for curing different diseases and medical conditions. Talking about color therapy has to do chakra. Chakra is the center of energy in the body. Okay, the body has chakra, which are 7 energy centers strategically distributed throughout the body and are responsible for regulating health and impacting emotionally and spiritually. One of the chakras in our body is the green chakras, who play a role in support balance, harmony, love, communication, social, nature, and acceptance. So I use green therapy with green LED to overcome for work fatigue. Okay, for the next, I will explain related to acupressure. Acupressure is a complementary treatment that use fingers and hands to stimulate acupoint and maintains the balance of energy. Acupressure therapy stimulates the body's circulatory, lymphatic, and hormonal systems. These are the acupoint. This one is called Heku or large intestine 4, and this one is called gallbladder 21 or Jianjing. Okay. Heku is located between the thumb and index finger, and gallbladder 21 or Jianjing is located between the 7 cervical spine and the base of the upper arm. Okay, the following is the biochemical mechanism of acupressure. Starting from activation of acupoint, so it will ion channel activation, continues to the brain through sensory neuron networks. So will hypothalamic pituitary adrenocortical axis activations. So it will happen, increase cortisol level and endorphin and serotonin transmission, and will cause increased relaxation response with increased physical performance. The benefit of acupressure are relieve stress and anxiety, improve sleep, relax your muscle and joints, regulates digestive issues, minimize headaches and migraine, and beneficial for back pain and menstrual cramps. Like the Professor Hsiao-Yean for insomnia, acupressure is also used to treat insomnia by pressing acupoint yin tang 30 times pressing with the fingers. About work fatigue is a feeling of weakness, tiredness, or lack of energy.
I'm sorry, Dr. Heni, your camera.
Okay.
You can turn down your camera.
Bye.
Sorry.
Okay.
We can clearly.
Okay. Yes. Okay, I'm continue. Work fatigue is a feeling of weakness, tiredness, or lack of energy. Work fatigue represents extreme tiredness and reduced functional capacity that is experienced during and the end of the workday. These are 3 types of work fatigue, namely physical work fatigue, mental work fatigue, and emotional work fatigues. Causes of work fatigue are physically or mentally taxing work, boring or repetitive tasks, sustained tasks, stress, shift works, compressed or long work days, poor lighting, extreme temperatures, constant noise, and vibrations. The effect of work fatigue reduces alertness and vigilance, reaction time and the ability to react appropriately, memory and recall, reduce ability to make effective and or quick decisions, fatigue reduce information processing and reduce effective communication. One of the intervention to overcome work fatigue is to provide a combination of color therapy and acupressure by developing an instrument called Chromopressure. This research was funded by the Ministry of Research and Technology Republic of Indonesia. Okay, using my title article is using Chromopressure to reduce fatigue among women workers in the food industry. The introduction of my study is work fatigue is a phenomena that is often experienced by workers. 50% of 80% of work accidents due to human error are caused by work fatigue. And women workers in the informal sector are larger than the formal sector because jobs in the informal sectors have flexible hours and do not have many conditions to enter. In Magelang City, the work sector is dominated by female workers. Data from the Magelang City Department of Industry entered in 2014 stated that of the total 3,306 workers, 2,223, about 60%, were female workers. Generally, they work in the food processing industry, which dominates micro and small industries in Magelang City. The results of initial observation of 5 female workers in the snack food industry state that they often felt pain in the muscle, stiffness in certain body parts, drowsiness, and boredom. Work fatigue experience continuously will reduce performance and increase the level of work errors so that it has an impact on work stressors obtain of work productivity. Okay, the following is a picture of work in the food industry. There are 4 toasters, but they are carried out by 1 workers. So that workers have to work on 4 toasters. So it causes work fatigue. The other picture is researchers are providing intervention using Chromopressure. Okay. This is a picture of the Chromopressure instrument. This instrument uses several electrodes that are put into the skin. We have also registered the patent of their Chromopressure instrument, like this. The method of my study design use a quasi-experimental study with 2 group pretest post-test design. Study setting in 3 food industries located in 1 city in Indonesia were purposefully selected because many workers complain of fatigue. Sample size a total of 60 women workers in the 3 food industry. the ethical consideration, the study was approved by the Ethics Committee of Universitas Asia Yogyakarta. And research instrument, we use 3 instruments. Part 1 was instrument for data collection, 3 outcomes measure of UNIMA work fatigue instrument, Nordic body map, and blood cortisol test. And the data analysis is descriptive statistic and independent test. Okay, the following instrument we use to collect data are Nordic body map, yes, UNIMA work fatigue instrument. About UNIMA work fatigue instrument was developed by researchers and has obtained copyright certificate as following. Okay. The result of the study as follow. Characteristic of participant or respondent. The average age of respondent in intervention group was 46 years and control group is 43 years. About the length of employment, the average length of employment in both group is 5 years. There is no difference in age, marital status, and length of employment between 2 groups. Okay. With the UNIMA work fatigue instrument, the average reduction in fatigue score in the intervention group was 5.4, and in the control group was mean 4.59. There is a significant difference in the decrease in fatigue scores between 2 groups, with a p-value less than 0.001. As well as using Nordic body map and cortisol testing, there is a significant difference in the decrease in fatigue scores between 2 groups. For discussion, physiologically, acupressure helps to naturally release endorphins, healing the body from pain and blocking the signal that perceive pain. Beta endorphin is happiness hormone, opiate substance, and have an analgesic effect due to eliminating pain sensation by reducing the number of nociceptive action potential. Acupressure stimulates meridians, a network of energy in the body to increase the flow of Qi, subsequently reducing the symptom experience. Color therapy increases the function of the hypothalamus to produce melatonin that leads to a calming effect and fatigue reduction. Each color has a certain frequency, wavelengths, and energy that has a function to relieve pain or fatigue. Green color creates a sense of comfort, relaxation, reduce stress, balance, and calm emotion. Furthermore, green light therapy stimulates the formation of growth hormones and strengthens muscle, bone, and the immune system. So, chromopressures effectively reduce fatigue among women workers in the food industry in Indonesia. Chromopressure may help to maintain vital energy and thus reduce fatigue. Okay, thank you. Sorry, it is not clear because of my limited in speaking. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. It's okay, Dr. Heni. It's clear enough for me. And such a wonderful insight and presentations about the combination therapy between the color therapy or chromotherapy and acupressures. And for myself, this therapy is new for me too, especially using common only usual light color. It turns out to have a healing potential and perfectly combined with acupressure to release the worker's fatigue, and it's very cool. And we are going to the next 30-minute sessions, and we will start our discussions, our panel discussions. So for the audience who want to ask to Professor Shannon and Dr. Heni, just please click the raise hand button, and we will open for 2 live questions and 2 questions in Zoom chat. You may talk and write in Bahasa, and we will help to back translate your questions to Professor Shannon or Dr. Heni. Also, don't forget to introduce yourself and your institution or region before deliver your questions. So, please raise hand for the first questions. Is there anyone from the participant here want to ask? Okay, from Mr. Ari Jeffrey Arayeno. So, please open your mic, Mr. Ari Jeffrey. Yeah, can on cam. Okay. Okay. So, please unmute your microphone. Unmute your microphone, please. Mr. Ari Jeffrey, your mic is not open yet.
Okay, thank you. Sorry, does my voice sound clear?
Yes, yeah, clear.
Yes. Okay, thank you for the opportunity given to me. Thank you to the great presenter, Professor Shannon. Good morning, Professor.
Yes. Good morning.
I am very interested in the application of the complementary nursing in health service in hospital, Prof. But something that are question in my mind about sleep hygiene and light therapy. How is it usually implement in hospital around Thailand, in the common ward room or the outpatient service? And I'm curious, how is the application of sleep hygiene, especially for a person with difficulty in mobilization? One more question.
Yes.
Sorry, Professor say reduce the time in bed to less than 6 hours. Okay, whether that includes sleeping time during the day and at night or just at night?
Okay. Yeah, thanks for your 2 questions. How can I call you? Can I just call you Irene, or how can I call your name?
Yes, just time during the day at night 6
Yeah.
hours.
I mean your name. How can I call you?
Oh, my name is Ari Jeffrey Karayano.
So okay, call you Irene. Can I call you Irene?
Yes.
Okay, thanks, Irene. Irene, because here that probably know that because you usually the Indonesian name is quite long for us. So I was trying to find out, like a nickname for me to remind you. Okay, thanks for Irene for your 2 questions. So probably I can answer the last one firstly. And usually we're trying to reduce the patient time in bed, means it's during the nighttime. Okay, during the nighttime. So please don't let your patient to sleep 6 hours when you implement the stimulus control or either the sleep restriction strategy. Okay. However, during the daytime, we do not encourage patients have nap during the nighttime. I'm not sure in your country, I know you have your own religion, probably it's going to help you to build up your good habits. But, in Taiwan, probably other Western countries probably have the same situation. Usually you can take a nap. If you are not in work, probably you can just sleep for like a few hours. And when you sleep for hours, it means you are going to experience the sleep cycle. Do you still remember in the few slides I mentioned? So means at that time during the afternoon, if you take a nap, means you falling asleep and goes through the sleep cycle, means you are going to reduce your sleep drive. So if you have longer nap during the daytime, means you are going to have less nighttime to go to sleep. So usually you have to teach your patient with insomnia symptom, please just ask them that limit their time, sleep time, and please don't sleep during the daytime. Okay, this is a very important principle, but there's one exception. If the clients, your patients, they are like a bus driver. Okay, if his job is quite have like a dangerous, if the bus driver, he falling asleep, oh my God, that would be very dangerous, right? It's going to cause your passenger in dangers. So in danger. So I say that you should have to, implement this strategy based on who are your patients and what is their characteristics, and just find out the best way for them. Okay, I think this is the response to your second question. And the first one is about the sleep hygiene and light therapy. For sleep hygiene, actually based on the slide, I know that here that already my slide, and probably in your hand, you already have the handouts. And you can look at the slide. Actually, the American Academy of Sleep, actually, they do not suggest to implement the sleep hygiene alone, because sleep hygiene alone did not produce good results to our patient. Means there's no evidence demonstrate that sleep hygiene is good enough. I mean, sleep hygiene alone is good enough to improve the insomnia patient sleep. However, the sleep hygiene, if combined with others strategy like stimulus control or sleep restrictions or relaxation therapy, probably can improve the patient's sleep. However, I think sleep hygiene is still it's a good way for a nurse to teach your patients, no matter patient is inpatient or outpatient units. Okay, you can just deliver the correct concept to them. Please, for example, ask them to have more exercise, or just do not drink coffee 4 hours before the bedtime. I mean, this knowledge you still can deliver to your clients. There's no problem at all. Okay, and for light therapy, I think usually in a sleep center, I'm not sure in Indonesia, do you already establish a sleep center yet? But if the patient they go into sleep center, they have like a light box. Okay, it's just like a box, and patient can sit in front of the light box, and the box is going to use some certain lux of the light, and trying to stimulate your eyes, because during the nighttime, if you exposure to the light longer in the daytime, and in the nighttime when you fall asleep, you turn off the light, and then your eyes close and do not receive any light. Your the pineal gland in your head, in your brain, is going to secrete the melatonin. The melatonin is kind of neurotransmitter and help your brain to put into sleep. And this is how we use the light therapy to help our patient. But the light therapy usually will use it in like a circadian rhythm disruptors patients. Yeah, I think this is all my response. I'm not sure whether I respond your queries. Yeah.
Thank you, Professor Shannon. I will try to help to translate it in Indonesia.
Okay, please, Hilda.
Ya, jadi Mr. Ari Jeffrey, beliau menanyakan 2 pertanyaan, yaitu terkait dengan aplikasi sleep hygiene dan juga terapi cahaya pada pasien dengan insomnia ketika di Taiwan itu apakah dilaksanakan atau diimplementasikan pada kondisi rawat jalankah atau pada kondisi rawat inapkah gitu ya Pak Jeffrey ya. Kemudian pertanyaan kedua adalah terkait dengan pembatasan tidur, terapi pembatasan tidur pada BPTI tadi ya. Salah satu implementasi pada yang bisa dilakukan oleh perawat ketika menghadapi pasien dengan insomnia. Kemudian pada pembatasan tidur itu bagaimana harus dilakukan? Apakah dilakukan ketika malam hari kah atau ketika siang hari begitu ya Pak Jeffrey? Kemudian jawaban dari Profesor Shannon adalah untuk jawaban pertama pada sleep hygiene dan sleep hygiene utamanya sleep hygiene ini tidak bisa dilaksanakan secara tunggal. Jadi harus dikombinasikan dengan terapi yang lain. Jadi tidak direkomendasikan untuk diberikan secara tunggal. Bisa dikombinasikan dengan berbagai jenis terapi yang lain yang nanti bisa dicek atau dilihat di materi yang akan kita share setelah ini ya Pak Jeffrey ya. Terkait kemudian light therapy, mungkin karena di Indonesia itu belum ada sleep center. Jadi kalau di Amerika dan di Taiwan itu ternyata sudah ada yang namanya ini ya, sleep center study. Jadi pusat studi untuk kesehatan tidur. Nah, di sana setiap implementasi atau setiap intervensi terkait insomnia itu bisa dilakukan di sleep center. Sedangkan di Indonesia itu belum ada. Bagaimana kemudian implementasinya? Prof. Shannon menyatakan bahwa kita bisa gunakan yang namanya ruangan light box, jadi ruangan khusus yang dia memang dirancang untuk melakukan pengaturan cahaya di dalamnya. Jadi pasien itu bisa disesuaikan pengaturan cahayanya untuk tidurnya, untuk menjaga kesehatan tidurnya. Terkait pertanyaan yang kedua, tentang pembatasan tidur itu dilakukan pada saat pasien itu tidur siang. Jadi pasien yang tidur siang itu tidak boleh terlalu lama, karena itu akan mengganggu tidur malamnya, jam tidur malamnya. Ketika seseorang memiliki tidur siang yang terlalu panjang, maka tidur malamnya itu akan pendek. Nah, sedangkan tidur malam ini memiliki ada sleep cycle, ada biological clock tadi itu Pak. Jadi seseorang itu sehat ketika tidur malamnya itu dengan cukup. Kalau bisa dibatasi adalah tidur siangnya, bukan tidur malamnya. Tidur malam itu tetap sesuai dengan jumlah normalnya. Begitu. Apakah cukup jelas? Are you clear enough with the answer?
Okay, thank you. I think that's all. Thank you, Professor.
Thank you a lot.
Mr. Jeffrey. Okay, we continue to the second questions. Any one of you want to ask, please click the raise button. Don't forget to introduce yourself and your institutions. Where are you coming from? When I see the participant here, we also have nurses who work in Japan, Prof. I'm not quite sure. Indonesian nurses who work in Japan. Another question to Dr. Heni. You may also ask in Indonesia. Jadi dipersilakan menanyakan atau bertanya dalam bahasa Indonesia ya. Jangan hanya bertanya sertifikatnya saja, ini di room chat absensinya saja ya, link absensi dari saja yang ditanyakan. Ada pertanyaan terkait dengan presentasi dari Dr. Heni. Sedikit saya menyimpulkan presentasi dari Dr. Heni adalah terkait dengan kombinasi antara terapi warna, jadi penggunaan terapi warna dengan terapi acupressure, jadi pemijatan pada titik-titik akupoin begitu Bu, dan ternyata terbukti efektif dalam mengatasi fatigue atau kelelahan yang terjadi pada pekerja yang bekerja di bidang food industry Bu,
Ya, ya betul, Bu. Nggih.
Terutama food industry.
Sektor
Kira-kira
informal.
sektor
Karena sektor informal itu belum ada yang memperhatikan, juga tidak ada BPJS dan sebagainya, sehingga kita penelitiannya ke sana. Ada pertanyaan di chatroom Bu Hilda, sudah saya jawab itu.
Oh, nggih. Apa itu?
Jadi apakah akupressure bisa dilakukan pada ibu hamil? Jadi I would like Ibu Hilda to translate in English. Ya, saya akan menjawab dalam bahasa Indonesia. Pertanyaan yang di chatroom, terima kasih Ibu. Jadi apakah akupressure bisa diberikan pada ibu hamil? Ya, jadi akupressure itu aman gitu pada dasarnya. Namun kalau pada ibu hamil kita harus menghindari titik-titik yang bisa memicu terjadinya kontraksi otot rahim yang akhirnya bisa terjadi partus prematur. Sebagai contohnya, misalnya kita menghindari titik LI4 atau heku tadi yang terletak di antara ibu jari dengan jari telunjuk. Nah, di situ dihindari karena ketika dilakukan pemijatan di titik tersebut, ini akan memicu terjadinya HIS ya atau kontraksi otot rahim. Kemudian selain pada titik heku, juga pada titik SP6. Sanyin Jiao itu yang terletak 4 jari dari malleus interna kanan kiri di kaki itu dihindari. Tetapi yang lain-lain itu insya Allah aman. Apalagi misalnya pada ibu hamil muda trimester 1 kan sering terjadi morning sickness. Nah itu silahkan dipijat pada titik P6 atau neiguan yang letaknya yaitu sekitar 3 jari dari pergelangan tangan ya. Jadi 3 jari dari pergelangan tangan ini namanya titik neiguan atau P6 bisa digunakan untuk mengatasi morning sickness. Kemudian pada ibu yang menjelang persalinan, saya juga sudah melakukan penelitian, bahkan ini dulu disertasi saya, jadi yang dilakukan pemijatan yaitu tadi pada titik LI4 yang di antara ibu jari tangan dengan jari telunjuk, lalu di titik GP21 tadi, ini pada saat kala satunya ya, karena menunggunya terlalu lama supaya ibu tidak lelah, tidak capek, itu dilakukan pijatan di GP21. Kemudian pada saat mulai kala maksud saya pada saat di fase aktif ya, pembukaan 4 sampai 10 di mana kontraksi sudah semakin intens gitu, dilakukan pemijatan di titik ini BL32 atau seliau yang di daerah spinal sini nggih. Kemudian juga pada titik SP6. Itu 4 titik yang kita lakukan untuk memicu terjadinya kontraksi otot rahim, ataupun juga bisa pasien pasien ingin mengejam terus namun serviks belum bisa membuka sempurna, nah itu juga bisa dilakukan pemijatan di titik LI4 tadi. Sementara itu Bu Hilda, terima kasih.
Terima kasih kepada Dr. Heni. So I will retranslate a little bit, Professor. So the acupressure, the participant asking about is acupressure is okay to be implemented to the pregnant woman. So Miss Heni said that it's okay for certain point, and we have to avoid some point which can induce the contractions during the pregnancy. And then we have another question.
Ada lagi Bu Hilda itu
ya, di room chat ya, izin bertanya, apakah terapi warna bisa dilakukan untuk pasien kanker? Persilahkan Bu Heni.
Ya. Terima kasih pertanyaan dari Ibu Rina ya, pertanyaan yang sangat bagus. Betul sekali Ibu. Jadi sebenarnya kalau di artikel-artikel yang ada di jurnal baik internasional bereputasi maupun internasional saja, itu kebanyakan adalah terapi warnanya untuk reduce fatigue, mengatasi kelelahan akibat dari penyakit cancer paling sering. Nah itu justru yang untuk kelelahan kerja itu belum ada. Jadi akhirnya ini saya menerapkan gimana ya kalau kelelahannya itu bukan kelelahan karena penyakit tetapi karena tadi kerja gitu. Saya cobakan itu juga berawal justru dari kelelahannya kalau di jurnal-jurnal adalah kelelahan dari penyakit, misalnya karena HD, gagal ginjal kronik, kemudian karena kanker, terus kemudian karena multiple sclerosis dan sebagainya. Kalau Bapak Ibu membuka jurnal, mesti banyaknya adalah ini kromoterapi atau color terapi untuk fatigue yang karena penyakit. Tetapi yang untuk karena kerja itu justru sangat terbatas atau bahkan belum ada, sehingga ini saya pertama menerapkan dan alhamdulillah bisa ya. Yang kami gunakan adalah terapi warna hijau dengan green LED. Kenapa hijau? Karena hijau itu tadi sudah saya terangkan itu untuk mensupport keseimbangan. Jadi sedikit cerita nggih Bu Hilda. Jadi kalau dari konsep terapi warna Bapak Ibu, itu tubuh kita itu terdapat 7 cakra ya. Cakra itu merupakan pusat energi. Nah, 7 cakra itu ada merah, kemudian ada kuning, kemudian ada oranye, ada violet, ada biru, dan ada green. Nah, bisa terjadi penyakit menurut terapi warna itu kalau energi yang ada di tubuh kita ya tadi di cakra-cakra itu jadi tidak seimbang, apakah berlebih ataukah kurang, sehingga kita memberikan terapi warna ini dalam rangka menyeimbangkan kembali energi yang ada di dalam cakra sehingga tubuh menjadi sehat. Nah, kembali ke lampu hijau atau tadi terapi warna hijau itu karena bisa mendukung adanya balance ya, keseimbangan, kemudian juga karena untuk harmoni ya, kemudian untuk relaksasi gitu ya, untuk mengurangi ketegangan itu disarankan warna hijau. Tapi seandainya Bapak Ibu nanti menemukan pasien yang katakanlah dia kena penyakit kronis, kemudian dia putus asa ya, misalnya nggak mau minum obat, sudah bosan lah ibaratnya kayak gitu, maka sebaiknya jangan menggunakan terapi warna hijau karena nanti akan semakin tidak mau lagi, tetapi digunakan bagi orang-orang yang kurang bersemangat, itu bisa menggunakan red color ya, atau menggunakan terapi warna yang merah, seperti itu Bapak Ibu. Terima kasih.
Terima kasih Dr. Heni. Saya rasa jelas ya jawabannya. Jadi warna yang memang digunakan untuk mengatasi fatigue pada kelelahan yang diakibatkan kerja itu memang adalah warna hijau. Dan bisa juga digunakan untuk pasien-pasien dengan kanker menggunakan terapi warna yang lain. Tapi apabila ada kecemasan, apabila ada depresi, kita bisa gunakan warna yang lain, seperti warna merah. Gitu. Sudah jam 10. I will try to back translate it for the last questions from Miss Rina. Miss Rina is asking about is color therapy or chromotherapy is also can be implemented to the cancer patients. And Dr. Heni said that it can be implemented to the cancer patients. And her study in Chromopressure, the combinations between the color and acupressure is the leading study, the pilot study. For women workers. I think enough for the question session, for the discussion session, because we already reached at 10 AM. So,
I'm sorry, Bu Hida, masih ada one question in chat room.
Oh, okay.
Yeah.
Maybe this is the last question, right? This is the last questions from the Zoom chat. If you have any more questions, you may send your questions to our committee, and we will send to Dr. Heni or Professor Shannon directly, and they will answer it. Use the communications to. So the last questions from Malinda. Pertanyaan terakhir dari Malinda, Bu Heni, atau yang
ya, yang itu ya, yang tonifikasi ya, sebentar. Mana ya tadi? Ya, ya intinya tadi saya membaca ada yang bertanya bagaimana tentang kekuatannya ya, tonifikasinya dari akupressure. Jadi memang akupoint itu letaknya di bawah kulit ya. Jadi ciri-cirinya untuk akupoint itu ketika kita tekan itu memang agak terasa nyeri ya. Nah, kalau itu kita tekan terasa nyeri itu berarti kita sudah mengenai akupoint karena memang letaknya akupoint itu berdekatan dengan serabut saraf ngaten nggih. Jadi ditekan nyeri itu akupoint sehingga bagaimana kekuatan penekanannya ini memang ukuran yang objektif saya belum menemukan, tetapi kami tadi dengan menanyakan respon dari pasiennya. Ketika kita tekan, dia sudah terasa atau belum, gitu ya, kesakitan atau tidak, kita melihat respon. Nah, kemudian setelah kita melihat respon pasien sambil memberikan terapi, nah itu kita berikan sejumlah yang rata-rata kemauan standar supaya mudah Bapak Ibu 30 kali. Sebenarnya kalau dari ilmu tradisionalnya akupressure gitu, ketika ditekan terasa nyeri itu berarti energinya adalah lebih, maka harus kita lemahkan. Nah itu pijatannya sejumlah 40 sampai 50 kali ya, berlawanan dengan arah jarum jam. Tetapi kalau ditekan itu terasa nyaman, itu berarti eksis ya, maka harus kalau ditekan terasa nyaman itu berarti energinya itu justru lemah harus dikuatkan, pijatannya 20 sampai 30 kali searah jarum jam. Namun dari jurnal-jurnal internasional yang saya baca semuanya itu tidak mempermasalahkan arah jarum jamnya, kemudian Bapak Ibu ini jumlah pijatannya, tetapi mereka menggunakan satuan yang objektif yaitu time ya, waktu. Ini misalnya pijatannya selama 15 menit per setiap kali pemijatan untuk akupoint yang bilateral, misalnya kanan kiri seperti itu. Seperti hanya di penelitian kami itu Bapak Ibu, jadi kan kami tidak memungkinkan memijati sejumlah pegawai yang banyak tadi, sehingga kita mengembangkan alat Bapak Ibu. Jadi kami kerjasama dengan orang teknik gitu. Nah ide-ide semua ini berangkat dari kami, termasuk kajian gelombang yang digunakan itu dari kami. Kemudian untuk perakitannya itu memang kami kerjasama dengan orang teknik. Nah itu kami membuat alat yang disebut Chromopressure, di mana di dalamnya itu ada terapi akupressernya, jadi berasal dari gelombang audacity, dari gelombang suara, kemudian oleh transformer diubah menjadi pijatan. Nah, gelombang yang kita gunakan adalah gelombang sinus dengan frekuensi 30 Hz, ya. Kemudian ditransfer oleh oleh transformer menjadi pijatan, dari suara itu menjadi pijatan, kemudian dialirkan ke pad. Nah, padnya itu kita tempelkan di akupoint pasien, karena yang kelelahan pada bekerja di food industry itu tadi pada bagian tangan, tadi Bapak Ibu sebenarnya saya ada videonya, namun waktunya mungkin nggak cukup kalau diputarkan. Jadi satu pegawai itu dia dihadapkan dengan 4 pemanggang, itu dia bikin egg roll itu salah satunya. Nah jadi 4 itu dikerjakan sendiri, jadi sini naruh, yang di sini ngelingkari, yang di sini nanti apalagi, jadi kerjanya sangat cepat, maka yang terjadi kelelahan itu pada daerah tangan. Sehingga yang kita terapi adalah di titik istimewa saja, yaitu titik LI4 dengan titik GB21 gitu Bapak Ibu. Ya, jadi untuk kekuatannya melihat dari respon pasiennya, ya. Kalau pasiennya kesakitan sekali tentunya kita kurangin, namun kalau belum terasa ya itu berarti belum kena akupoint, harus kita tambah lagi kekuatannya. Ya, terima kasih.
I believe it's clear enough to the answer. Jadi saya rasa sudah cukup jelas ya. And also Professor Shannon, I also ever read your publications that you also doing a study on acupressure. Is it right? Maybe you have some comments or share your experience about acupressure.
Oh yeah, thanks Hilda for your notification. Yes, I think here that the acupressure, actually just like acupuncture, is a very traditional Chinese medicine. So usually in Taiwan or even in mainland China, if you want to do the acupressure, must be implemented by the certified Chinese medicine practitioner, and usually nurses cannot do acupuncture. Acupuncture means you use a needle, just insert into a certain acupoint to stimulate. Okay, the De Qi is a kind of like a Mandarin, or is a mystery of Chinese medicine. However, acupressure actually, just like Dr. Heni mentioned, is the things that the nurses can implement into our patients. However, I still recommend that if the nurses want to implement the acupressure, in addition to using some of the reference to select the certain acupoint for as your reference, I think of seeking a certified Chinese medicine practitioner, I think is also important in your study. Okay, because they will teach you how is the, because when you do the acupressure to the acupoint, because you want to create the same, produce the same function as acupuncture did, right? So you have to make sure that you have to place the right place, and you have to make sure the strands you use put on the acupressure can stimulate as the same function as acupuncture. Okay, so I think if you have the certified Chinese medicine practitioner can assist a nurse to do so, I think that would be very wonderful. Okay, yeah, I think of course in Indonesia, people, if the student or even like a faculty in Indonesia, if you want to co-work with acupressure, I think in Taiwan we have a lot of resources can help you, can do like a cross nations help. Okay, so I think this is all my response. Thanks, Hilda.
Thank you, Profesor. Jadi sedikit mentranslate dari apa yang sudah disampaikan oleh Profesor Shannon tentang akupresur. Ternyata akupresur ini di negara Taiwan itu memang awal mulanya itu adalah dari memang pengobatan Mandarin gitu ya, pengobatan Cina asli awalnya berupa berbentuk akupunktur. Tetapi untuk pemberian terapi akupuntur sendiri itu tidak boleh dilakukan oleh perawat, hanya boleh dilakukan oleh terapis atau practitioner yang memang dia sudah dilatih secara khusus gitu ya, untuk memberikan asuhan atau memberikan layanan akupunktur. Kemudian kalau akupressure sendiri harus dipastikan bahwa tekanan yang kita berikan itu memang telah menyentuh titik akupoint yang tepat. Dan Profesor Shannon juga menawarkan apabila ada teman-teman atau ada dosen ataupun tenaga perawat yang berkeinginan untuk melakukan studi riset terkait dengan akupressure lebih mendalam, silakan datang ke TMU gitu ya, silakan belajar di Taiwan. Di sana memang sudah ada pusat studinya juga terkait dengan traditional Chinese terapi seperti ya. So I think enough for this panel discussion session. I hope the audience satisfied with the answers, and thank you for your active participation. And this is the last session on my role here as moderator. Again, I say thank you so much to the audience, and I give back the mic to our master ceremony, Ms. Shirley and Salahuddin. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Warahmatullahi wabarakatuh. To all the speakers and moderators, thank you for sharing with us.
Terima kasih diucapkan kepada seluruh narasumber dan juga moderator.
Ladies and gentlemen, the next agenda is to hand in the certificate for all speakers. To all speakers, first is Professor Shannon Chiu, RN Ph.D, Dr. Heni, Setyowati, Esti, Rahayu, S.Kp, M.Kes. Also to moderator, like to Ms. Hilda Nasarina Desi, S.Kp, M.Ks.
Hadirin Bapak Ibu yang kami hormati, selanjutnya penyerahan sertifikat kepada narasumber yang terhormat, Profesor Shannon Chiu, RN, Ph.D, dan Dr. Heni Setyowati, S.D. Rahayu, S.Kp, M.Kes, dan juga moderator Ibu Hilda Mazrina Dewi S.Kp, MS, MSc.
This is the certificate for Professor Shannon.
The next is certificate to Dr. Heni. Terima kasih for Mr. Mazarina Devi. Okay, thank you, ladies and gentlemen. Please be reminded to fill out the closing consent form that has been shared on the Zoom and YouTube chat room before moving to probably the exciting section that is the talk back.
Baik, Ibu hadirin sekalian, dipersilakan untuk mengisi form presensi penutupan yang telah di-share di Zoom, chat maupun link chat YouTube. Sebelum kita menginjak acara yang terakhir ini, yaitu pembagian door prize.
Okay, the first door prize is awarded to Ari Jeffrey as an active participant. Give applause to Ari Jeffrey. Okay, second and third door prize come from spin wheel application. So please welcome you to run the spin wheel. Hsiao-Yean for the third door prize. Okay, so congratulations to the door prize winner. Please contact Heni or Matilda as the contact person for the door prize details.
Diucapkan selamat kepada pemenang door prize pada pagi acara webinar pagi hari ini.
Last but not least, on behalf of Faculty of Health Science, would like to thank you for joining today's webinar.
Sebelum di penghujung acara, saya selaku pembawa acara mengucapkan terima kasih dan mohon maaf yang sebesar-besarnya apabila ada kata-kata yang kurang berkenan di hati para hadirin. Dan dalam kelangsungan acara, terdapat kekurangan yang disengaja maupun yang tidak disengaja.
Webinar participants are expected to remain in the WhatsApp group until we share complete tickets in about the next 2 weeks. And also to all the participants, please on your camera. We will to take your photo with the stickers.
Diharapkan kepada peserta webinar diharapkan untuk tetap berada di dalam grup WhatsApp hingga sertifikat selesai. Kami bagikan kurang lebih dalam kurun waktu 2 minggu ke depannya. Jadi mohon untuk kamera untuk diaktifkan untuk sesi dokumentasi.
Well, that's the end of our international webinar. Let's close this event together by saying Alhamdulillahirabbil alamin. Hope today's seminar is useful for all of us. Thank you for your presence.
Demikianlah seminar internasional hari ini. Mari kita tutup acara ini bersama-sama dengan pembacaan Hamdalah Alhamdulillahirabbil alamin. Semoga seminar hari ini bermanfaat bagi kita semua. Terima kasih atas kehadiran Bapak Ibu hadirin sekalian.
So participants, we look forward to seeing you at the next event. Thank you. Good afternoon.
Para hadirin sekalian, sampai jumpa kembali pada acara webinar berikutnya. Selamat siang, terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Bapak Ibu semua. See you next time. Thank you very much.
Thank you, Dr. Heni, and thank you, Professor Shannon, for coming.
To all the participants.
Yeah, thank you for your invitation and see you next time. Bye-bye.
Thank you so much. Bye-bye. Diharapkan peserta tetap tinggal di grup WA ya sampai sertifikatnya selesai kami bagikan. Termasuk juga untuk materi, CV juga akan kami berikan. Jadi tetap dimohon untuk tetap tinggal di grup WA peserta. Kurang lebih 2 minggu ke depan.